Hi, Dr. Tracy, board certified general pediatrician, and let's talk pink eye. I'm going to try to make this fast because I'm learning that the longer videos, no one finishes watching them anyway. So we're going to go fast. Pink eye in pediatrics is extremely frustrating. So pink eye means conjunctivitis. So if you hear your provider talking about conjunctivitis, they mean pink eye. They are the same thing. Conjunctivitis itself is just inflammation of the thin membrane on the eye. And it's really, really common in children because they're constantly getting upper respiratory infections. They're rubbing their eye and they're inputting things in there. Just because it's conjunctivitis or pink eye doesn't tell you what's wrong. It doesn't tell you if it's a virus or a bacteria, if it's allergic, if it's chemical, if it's an irritant. So here's a few ways that you can tell, and a few ways to tell if your child needs to A, stay home, B, need antibiotics, C, needs to see their doctor. The first thing is viral versus bacterial. The majority of little kids have bacterial conjunctivitis because they have had a cold, they rub their nose, then they rub it into their eyes, they're playing, they don't wash their hands, they rub their eyes, they touch each other, then they touch their eyes. So the majority of little kids, it is bacterial, but they can have viral. So the way you can tell the difference is usually one eye that is very red and more drainage than red. So it's a little red, but it's like lots of copious, thick, yellow, green, disgusting discharge. And it gets worse throughout the day. So it starts off with a little bit of mattering of the eyelashes in the morning. Maybe they're stuck shut. And then throughout the day, it gets worse and worse and worse. There sometimes can be an upper respiratory infection. There sometimes can be an ear infection. Sometimes there's nothing else wrong, and it's just the eye drainage. So in general, that is going to be bacterial. It can spread to the other eye, but it usually starts with one eye. It doesn't have to have antibiotics, but it does get better faster, and it helps children get back to school and daycare sooner, so reach out to your provider. Viral is typically going to be both eyes around the same time, a little bit more watering, more red. They're very red. Kids look kind of scary when they come in. There can sometimes be some swelling of the whites of the eyes. They sometimes have runny nose, cough, congestion. It can be sometimes itchy, but not usually painful. And it doesn't get worse throughout the day. That is usually viral. And there's lots of viruses that can cause conjunctivitis. Adenovirus is the number one, but lots of them can do it. It's going to last 7 to 10 days. Antibiotics are not going to touch it. The bad news is it's hard for them to be able to get clearance to go back to school until the eyes look better. So give it a day or so. Treat them with antihistamines. If it's not getting better, reach out to your primary. You can also start with viral conjunctivitis and lead to bacterial conjunctivitis, because if your kid is messing with their eyes a lot, it can lead to bacterial conjunctivitis. So if it starts off looking viral and then starts to get worse, that's a reason to reach out and you might need antibiotics. Allergic conjunctivitis is a little bit different but hard to tell from viral. This is usually over the age of 8. Little kids aren't going to necessarily get allergic conjunctivitis. They're usually pretty swollen. The whites of the eyes can be quite swollen. They're very itchy, slightly watery, and very red. That is going to be treated more with an antihistamine and sometimes a topical antihistamine on the eyes in form of an eye drop, which can help. They're not contagious. They can go to school. If you're not able to tell the difference, reach out to your primary. The other thing is chemical. This is a little bit more obvious because I think parents know what causes it. So we used to see this a ton in Florida. Swimmers, they would be playing in the backyard pool, go to the neighborhood pool, come back, get chlorine in their eyes, and everything is bright red. So a lot of times you know what the irritant is and it's easier to tell. Here's some dangerous signs and reasons to reach out to your provider immediately. High fever and a really, really red eye can be concerning. The tissues around the eye being very red, puffy, and swollen can be concerning. Something progressively worsening. Trouble with vision and a blistering rash around the eye that then spreads into the eye. So I hope this helps a little bit, help you determine the difference between bacterial, viral, allergic, chemical. But the general rule of thumb is if your child is well appearing, it is both eyes, it is not worsening throughout the day, it is likely viral or allergic, treat them with an antihistamine, have them wash their hands, they're fine. Talk to your school about whether or not they can go to school. If it's one eye, it's really nasty discharge. If it's worsening throughout the day, they have a fever, other signs of infection, they don't feel good, a little bit more likely to be bacterial. Little kids under the age of 2, almost always bacterial, reach out to us. So I hope this helps a little bit. If you have any questions, because I tried to do this as fast as I could, leave some comments and I'll do a little bit more videos if I have to. Take care.